Let's talk about why a doctor would order thyroid tests. So it's common, particularly in the primary care doctor's office, where a patient may come in with some symptoms, and the symptoms might be ones like fatigue or weight gain or dry skin or common symptoms. And one of the diseases that is associated with those symptoms, it would be hypothyroidism or a low thyroid. And in order to be able to make a diagnosis would, of course, be the history, the physical exam, and then some blood tests. And those commonly in the primary care office might start off with a TSH or thyroid stimulating hormone. That would be the screening test that would tell us whether or not the thyroid levels were normal or were abnormal. In the case of hypothyroidism or a low thyroid, would be associated with an elevation of the TSH. Then a subsequent test, which is often reflexly done by the laboratory, would be a T4, which would typically be a free T4. So with those two tests, the diagnosis of hypothyroidism could be made. And then commonly, since this is the most common cause of hypothyroidism in the United States, a test to look at what's called thyroid peroxidase antibodies would be obtained. That test is to indicate whether someone has Hashimoto's thyroiditis. And Hashimoto's thyroiditis, as I mentioned earlier, is the most common cause of hypothyroidism in the United States. And as a result, if that is positive, then we have a diagnosis of hypothyroidism if the thyroid function tests are abnormal, and in the case of the antibody test being positive, as a result of Hashimoto's thyroiditis. So that's a common scenario in a primary care physician's office. But then those patients may come to an endocrinologist like myself for further evaluation and treatment.